Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valenson. We're taking your calls at 866-870-5752. That's 866-870-5752. And you might want to check out Dr. Darrow's website at lastemcells.com. That's www.lastemcells.com. You can see him performing the treatments on video, and you can email Dr. Darrow off of every page on the site. You get a free book by calling in today. And if you want the ebook, you can email Dr. Darrow and he will send you the ebook. It's all free. So that's what's going on today. And in the office is also a diet plan for you, Ideal Protein. Dr. Darrow was just talking about that. And there's other things going on in your body. You got to pay attention and you got to call us. You've got muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, knee pain, hip pain, arthritis pain, and stiff joints, dull aches, and maybe little problems that are growing bigger and bigger that are, need an intervention. So it's 866-870-5752. I bet you have another question waiting.
Always. We already covered in the first part of the show knees and backs, although there's a lot more to talk about with them. But I'll take one on a shoulder right now. Let's see what this person said. Oh, this is fun. It's like 2, 4, 6, 7 words. I have a shoulder tendon subscapularis tear. That's the question. Well, guess what? So do I. I know I'm being funny, right? But I mean, the guys watching the video, of the show right now can see me lift up my arm, and this is with a subscapularis tear. Well, guess what? I also have a supraspinatus tear, and I have a labral tear in the back of my shoulder. Yeah, it's all smashed up. Years and years and years of sports. I shouldn't say it exactly like this, but you'll get the idea. My shoulder should have tears in it after all the usage. I mean, the tendons are just bands of collagen that attach muscles to bone. So every time you contract your muscle, you're pulling on that tendon. So it's like a rubber band. You've seen rubber bands that are worn down. Well, the nice thing is, I used to do this when I was a kid. I would take rubber bands and make golf balls out of them. Golf balls used to be wound with like rubber bands. It wasn't exactly that. They were called balata balls, and they were soft. You could smash the club into it and it would leave a mark from the club and the ball. But at any rate, the tendons in the shoulder or anywhere else are similar. And what I used to do as a little boy is when there'd be tears on the rubber bands, I would take rubber cement and fill it in. And then I'd be able to hit the ball again that I made. So with the shoulder tendon, the subscapularis, the infraspinatus, the teres, blah, 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 it's simple. We just inject the area with your cells, okay? We take your blood to get PRP, platelet-rich plasma. We take the blood, we spin it in a centrifuge, we take the red cells out so they don't hurt, and we use the platelets that stimulate tissue to grow. They have growth factors in them. And we put them right into these tears, or around the areas if it's a tendinitis, and the tissue grows back and heals, and the pain goes away. So I had to inject my right shoulder a few times. I must admit, it didn't heal overnight. Many years ago, when I first discovered regenerative medicine, it took one series of injections. That means one time. I did poke it a few times, and I didn't even know exactly where I was poking. I just hit the spots that hurt. And I woke up 12 hours later in the morning, and my shoulder was completely pain-free. And it was a useful shoulder, full range of motion, no problems with sports for a good dozen years until I re-injured it, and the next time it took me 2 injections, 2 times.
That's amazing.
Now, It is amazing. And, for me, this has been, I'm going to use the word a miracle. It's not really a miracle, but it can work very quickly. And I do want to put a caveat in here, though. I did injure my shoulder a third time, which was about 2 years ago. And that took me several months and several injections to heal up. But like I say, it's good now. I was persistent. Of course, I get seduced like everybody else to think that surgery may be the quick fix. And thank God I didn't do it, because I did have a surgery when I was stupid. When I was in medical school, I'm going to just tell you, I was stupid about this. And I rushed in to get a surgery for shoulder pain, and it made my shoulder much worse. And since then, since medical school, I have not done a surgery for musculoskeletal on my own body. I've injected many areas that I would have thought needed surgery. My knees, my elbows, my wrist, both shoulders. And I fought it. I kept injecting until I healed up. So it's not something that is overnight for many people. I do get a lot of people who heal overnight, but most people it takes about 6 or 8 weeks with injections every couple of weeks to heal. So don't come in if you're looking for the overnight miracle. I'm not going to promise anything. I wish I could. It just doesn't work like that for most people.
It's still better than an elective surgery in many cases. Would you like to go to talk?
Well, there's a lot of... I will, yeah, I will. I see them. A lot of people need that surgery, not because they do physically, but because they do psychologically. Yep. And there's people that get multiple surgeries, they never work, and they keep going back for more. I got stories about that, but I want to take Joanna's call so she doesn't have to keep waiting, and then we'll get back to it. So, Joanna, this is Dr. Marc Darrow. I understand that your big toe bothers you. Do you have a bunion there?
No, I don't. I had it looked at, and they said it was the beginning of some arthritis. And I wondered if your stem cell healing works at all on arthritis.
It usually does, yes, but you're going to have to do enough of it. If I do your toe, we would probably use depending on what I think and what you think, I would probably do platelets from your blood to heal that up. If it was advancing, then I would add to the platelets, I would add some stem cells to it. And we treat toes all the time, and even great big fat bunions we treat. When I do your toe, if you come in, please know I'm going to ask you to wear a walking boot. No one likes walking boots, but that makes them heal real quick after we inject them. So it's smart if you're going to get injected, just go to a drugstore, pick up a walking boot and bring it in with you. Or what I do is after I inject, I send people to a drugstore and have them pick up a walking boot.
Got a linear fracture.
Yeah. Same boot should work. I mean, I'm not sure. I'd have to see it. I like the kind that comes all the way up below the knee, not just a little orthopedic shoe. They don't do the job. And a patient came in with a walking boot. One of my patients came in for a toe. I think it was yesterday or the day before, and they had a little. It was a little device on their other foot, on their left foot. And I said, "What is that?" And they said, "It's an even up." I'd never heard of that before. I wrote it down here. I just looked at the piece of paper. EVEN and then UP. And it's used for people that wear walking boots to put on their other shoe so that one leg is not longer than the other, and it makes it easy to walk. So if any of you have walking boots, look up the Even Up. It's a cute little thing that fits on the bottom of your shoe and will allow you not to be miserable wearing the walking boot.
And then you're out in West Los Angeles?
It sounds like you're out somewhere.
I'm in Anaheim in Orange County, but every Saturday I have to drive to Laurel Canyon to teach Dutch to 3-year-olds. So that's 40 miles up and 40 miles down.
Wonderful.
So that's probably not that far from you somewhere.
We're right off the 405 freeway. at Wilshire Boulevard, across the freeway from UCLA.
Yep, I used to live right there in that apartment section once upon a time. On Goshen.
Yeah, well, there's a lot of apartments around my office. Yeah. My office is right over there, actually.
And then, does
So,
your insurance?
let me do something first. Hang on 1 second. Then I'll let you ask your question. I want to give you my office number, which is 800-300-9300. 800-300-9300.
Okay.
You can call there to make an appointment, or you can call right now. There's people by the phones, or anytime, to find out if we take your insurance. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and we help people get care credit if they don't have insurance, which is a credit card where they don't pay any interest for your. So I interrupted you. Now, what is your question? I apologize.
That was my question. Did you accept insurance? You answered it already.
Oh, okay, cool. I accept insurance, but insurance doesn't pay for most regenerative procedures. Most insurance doesn't. So it'll often pay for your first visit, and then it may be cash or credit card after that. And the time that insurance does pay for it, if it's workers' comp or if it's a car accident, then they don't distinguish what it's for. They pay you these lump sums usually, and it'll pay for my procedures of regenerating
and if
the
you have a
body
diagnosis
using
and somebody wants
platelets
to
and
do
stem
surgery,
cells.
then will the insurance pay for regenerative?
No, they just pay for surgery. It's stupid. I don't know why. The surgeries cost them so much money and they fail.
I know.
I do know why, because the people that are directing the insurance companies are orthopedic surgeons. They're not going to cut off their nose to spite their face.
It often comes back to the money.
Everything comes back to the money on this planet. People ask me so many questions about medicine. I go, look at the money and you decide. You'll figure it out.
Follow the money trail. Well, thank you so much.
Yeah,
I will definitely call. I'm super busy. I have like 3 jobs, but that one does take me out, every Saturday. Well, not anymore. Our last class for the summer is on the 1st of June.
Well, we'll work it out. You just give us a call at 800-300-9300. I am not open on Saturday, but we'll figure something out.
It's great not to be open on Saturdays.
We're here.
Well, today's Saturday. I'm on the radio. I can't be doing your toe at the same time.
That's true too. It's hard to be in 2 places at once. God does it well, but the rest of us, we just have to be in one place at a time.
Well, God bless you, Joanna. I love your information, and I think it helps people understand what's going on. And remember, for you folks that have to wear a walking boot, pick up and even up, EVENUP, for the other foot. It does. When I saw it, I was like, why didn't I think of that? That's a winner. Well, yeah, it's already patented, I'm sure.
Okay,
let's get to Bob.
Thank you, Joanna. Appreciate your call. Okay, let's go to Bob in Longdale. And let's see. There you are.
Okay. Here I am.
Bob, Dr. Marc Darrow.
Hey, Dr. Darrow.
I want to be your best friend.
Pardon?
Yeah, I want to be your best friend. You know why? Because you're going to keep me busy for a long time.
Well, I think that I've been waiting for you all my life, which has basically been, I love contact sports, and I played them when I was in grammar school, even though we didn't have anything formal. The kids from high school would come back and we'd play tackle football, and that was kind of fun.
Are you a big guy, Bob? You have a deep voice. I'm wondering if you're one of those guys that had a lot of testosterone early on and grew big bones.
Probably. I'm 6'2", and I weigh, unfortunately, 248.
All right, well, that's not terrible. We have a diet in the office called Ideal Protein. People drop about 15, 20 pounds a month, so you'd be on it and off of it quick, and back to a weight that's going to serve.
In my life, I've lost probably 1,000 pounds. of course, gained it all back.
Yeah, well, I
But
understand.
I've been on Atkins
Yeah.
and
Well,
Lindora and keto, and yeah.
sure, sure, sure. Well, you know, there's a lot of training that goes in diet and learning about different foods, because there are good foods you can eat that taste good, that are low glycemic, that'll keep your insulin low. And the more you learn about it, the better you can do for yourself. I mean, you're not a giant, you're pretty good, but if you're 6'2", I'm about 6 feet and 170 pounds or less. I range between about 166 and 170. And I do it on purpose. You know, I stay as keto as I can. I do cheat here or there. I had a beer last night.
Well, when
And,
it comes to beer, I'm
you know,
going
it's
to cheat
not-
a lot. Remember, I'm a rugby player.
Yeah, well, I can't blame you on that. It's, yeah, oh yeah. But my point is, if you make it a way of life, you can cheat a little bit and still stay skinny. And if you decide to come in, I mean, you have left ankle pain, you've got 2 bad knees and shoulders, and if you come in, I'm going to say, Bob, do you mind if we talk about diet? And if you say you don't want to talk about it, I'm going to say, tell me to shut up, and I will. I won't talk
No,
about
I want
it.
you to talk about it.
But it is going to be okay. Well, it's going to behoove you to lose some weight, because every pound on your tummy or your butt or wherever it is about 4 pounds on those poor knees of yours. So you're up about, I'm gonna make up a number, it's not real, but you're up, let's say, 40 pounds above what you should be. That's 160 pounds of pressure on each knee. And we know that causes arthritis. So when we get you educated, you're going to want to do what I do.
Great.
And you're going to want to stay skinny. And it adds to years of your life. It makes your life better. It helps you get rid of a lot of different diseases that are forming as we age. How old are you, sir?
72.
Okay, so you're about where I'm at. I'm 70.
Yeah, I've got
And,
adult onset diabetes, type 2, so I've been controlling that.
Oh, well yeah. Well then, yeah. Adult onset diabetes is not anything at all other than an eating disorder. It's not really a disease other than you're creating a disease.
Yeah, that's what my
and it's one, we can get rid of that.
endocrinologist tells me, and I'm starting to believe him.
We can, if you come in the office, we'll put you on the ideal protein diet. Your diabetes will be gone in a month.
Great.
If not sooner.
Great.
So that's not even an issue. It's not going to work with type 1 diabetes where there's no insulin produced.
Right.
But the way that you are eating, you're driving your insulin up, and then you're probably taking metformin or some other medicine to lower the insulin, and that's kind of silly.
Well, no, I'm actually taking insulin, so I'm used to shots.
Well, that's real silly. That's really so bad for you, my friend.
Well, that's why
That's
I
the
need to
worst
talk
thing
to
you can be doing for yourself. Well, listen, I'm going to give you a couple bits of information here. One, go to my website, which is www.lastemcells.com, and if you email me, every page has a spot to email me, leave your phone number and I will call you up. Just say that we talked on the show, and I'll go over your diet with you, and we'll get you off of that insulin right away.
Yeah, well,
There's no reason for you to be on.
My knees have bothered me so for a long time. Ever since I played high school football, I got hit and hyperextended both knees, and I went in and talked to one of the surgeons here in L.A. that had done all the Lakers stuff, and they said, yeah, we could get you new knees. And I said, well, that's great. And then I could go out and get in condition again. I said, yeah, you could go out and do running. And I said, great. And then I could play rugby. And they said, no. And I said, forget it. I saw so many
I
saw so many people when I was in college getting their ACLs torn, and then they get this big zipper around, and then they couldn't walk after that without a stiff knee. So I never decided to go in and even see a doctor about my knees. So that's why I say I'm
like you. I mean, I have a meniscal tear in my right knee. I'm not getting surgery. I inject it. I put platelets and stem cells in there. It keeps me going. Am I perfect? No, my body's not perfect. It's 70, almost 71 years of beating it up. And I'm like you. I love sports, and I like to do them really hard, and I like to do it repetitively. And even when stuff hurts, I keep going.
Yeah.
So the cool thing is with regenerative medicine, using your platelets or your stem cells, we can keep going really indefinitely, Bob. But it's maintenance. And some people don't want to take the time, and a lot of people don't want to spend the money. They'd rather spend it on their car, which is fine with me. But or fixing up their house. I'd rather fix up my body. And I'm very fortunate because I fell into a profession that I use on myself.
That's great.
And I probably injected myself more than anybody on this planet Earth. And well, it's probably the truth.
Well, I don't know. I'm probably
it's probably the truth.
The insulin, but that's just a pain in the gut, I guess. That's where I take my shots.
Yeah. Well, if you're type 2 diabetic, you don't need insulin.
I'd like to get off as soon as I
a
can.
quick fix for something that. Yeah, when you inject insulin, you gain weight.
Well, then I'm fighting myself.
Insulin is a storage. It's a storage hormone. When insulin is high, we store fat. When insulin is low, we eat our own fat. That's what a keto diet is.
Right.
It's a diet where you lower your carbs or eliminate them, eat protein, veggies, and water. You get rid of grains and dairy products and fruit, except let's say berries.
Yeah.
And beer, unfortunately, beer has a huge glycemic index.
Yeah.
Not just that, it raises the insulin, but also it disinhibits you and makes you want to eat more. So that's a no-no for you.
Yeah, that's.
You and I'll go out once. You and I'll go out once a month to an Irish bar and have a beer.
You've got a deal.
But that's about it.
You've got a deal, partner.
New kind of treatment.
All right.
I'll tell you what. Bob, if you come in, make a late appointment. We'll go out to dinner afterwards.
Great.
I'll take you out.
Wow, I appreciate that.
And I'll buy you your last beer.
Oh, no. I'd have to be dying the next day.
Oh, you can learn.
All right.
things.
Well, Dr. Darrow, thank you.
So I appreciate your call, but for the last couple minutes we have on the show, let's talk about your left ankle. What happened to it? Was that football also?
Yeah, I was in the fourth grade, and I was running for a touchdown, and one of the high school boys caught up with me and stepped on my left foot as it was extended, out. I was getting ready to take the next step.
Oh, sorry, Bob.
You and I are going to have to do this one
Sorry,
personally,
guys.
Bob. Go to the website, www.lastemcells.com, Bob, and you can email me there and
Thank
I'll
you,
call
Bob.
you.
Appreciate your call. Thank you, Dr. Darrow. Thank you, Alex and Suzette, and everybody behind the scenes at Living Pain Free. Remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. And I'm your host, Nita Valens, and we'll see you next time.